Today we will be demonstrating the use of a universal instrument, the Barnhart 1-2. Remember, it has two parallel cutting edges. These techniques demonstrated today will apply to all universal instruments. We will start on the mandibular left facial surfaces. First, sit in the correct position and make sure the mandibular occlusal plane is parallel to the floor. Then determine the correct end by placing the terminal shank parallel to the distal surface with the toe pointed distally. Make sure you have a finger rest established. Flip ends if it's not correct. You can use your mirror to retract and get good visualization. After you have the right end, place the lower 1/3 of the cutting edge about 1 stroke mesial to the distal line angle. This is the initial placement at the distal line angle, which is for all posterior teeth. Establish your fulcrum, palm down, about 1 to 4 teeth away from the tooth you are working on. Make sure your fulcrum is not split. We usually start at the most posterior tooth, but for better video viewing, we will start on the second premolar. Close the blade to a 0 to 40 degree angle to the tooth. Gently insert to the base of the sulcus. Keep the grasp light. Open the blade to 70 degrees by pivoting on your fulcrum slightly away from the tooth. Activate by using short overlapping strokes. Pivot on your fulcrum and roll the instrument between your fingers to keep the end 1/3 always against the tooth as you go around the distal line angle to the midline of the distal surface. Finish the last activation stroke and remove the blade carefully. Re-establish your fulcrum at the distal line angle and place the end 1/3 about 1 stroke distal to that distal line angle. This is so the distal line angle is covered from both directions. Close the blade to about 40 degrees and insert to the base of the sulcus. Then open the blade to 70 degrees and activate with lateral pressure only on the upstroke. Keep the toe lower than the middle of the face of the blade and keep the terminal shank parallel to the tooth surface scaled. Relax your grasp and don't use any lateral pressure when you reinsert for the next stroke. Apply lateral pressure against the tooth while activating the blade with a 70 degree angle and short and overlapping strokes. On the distal and direct facial surfaces, you will use a wrist rocking or waving stroke. When you get to the mesial surface, on the mesial interproximal surfaces, it will be a more rotating stroke. Keep the end 1/3 adapted to the tooth at all times. Continue to the mesial line angle, pivot and roll the instrument to keep correct adaptation and go onto the mesial surface until the midline is covered. Close the blade and remove. Start at the next tooth and repeat the steps. You will be using the same end of the instrument but the opposite cutting edge on the facial and mesial surfaces compared to the distal. Always be aware of your angulation and adaptation. Watch your angulation and adaptation by looking at the back of the terminal shank. Do not try to see the full face. Next, we will move to the maxillary anterior facial surfaces. Readjust the headrest and your light. Make sure you and your patient are in the correct position. This time, you will begin on the midline of the canine. We will go from 6 mesial to number 8 mesial. Then we will do 8 distal to 6 distal. For anterior teeth, the initial placement is at the midline. Remember, it is at the distal line angle for posterior teeth. To determine the correct end on anterior teeth, point the toe in the direction you want to go. Make sure the face of the blade is tilted toward the tooth surface and the angle of the shank is not sticking out. The terminal shank will be across the tooth for the correct end. It will not be parallel. You will now place your fulcrum on the lingual incisal or occlusal surface, making sure it is not split. Then close the blade to insert to the junctional epithelium. Make sure you continually adapt the lower 1/3 to the tooth as you apply lateral pressure on the activation stroke. Keep your strokes short and overlapping. Go to the base of the sulcus with each stroke. Continue to do all the surfaces away from you in the same direction. To do the other half of the teeth, you will change your position. Make sure you have a neutral wrist. Flip ends to repeat the same steps. The toe is now pointed in the direction you are headed. The face should be slightly closed to the tooth, and you should not see the entire face of the blade. Close the blade to insert at the midline again and go to the junctional epithelium. Then open the blade to 70 degrees. Apply lateral pressure and activate the stroke up from the base of the sulcus. Make sure your fulcrum is not split. Repeat the steps for the next stroke. They should be short and overlapping. You must pivot on your fulcrum to make your instrument move. Pivot and roll at the line angle to keep the lower 1/3 adapted to the tooth at all times. Continue to the midline of the interproximal surface. When you've completed the interproximal surface, close the blade and remove. Go to the next tooth and you will repeat the steps. Always keep an eye on your angulation to maintain a 70-degree angle on all activation strokes. Next, we will go to the facials of the maxillary right posterior sextant. For demonstration purposes, we will be starting on number 3. Your patient's maxillary occlusal plane should be perpendicular to the floor, and you need to approach the area from the corner of the mouth with your palm up. You most likely will have to view the distal of number 3 indirectly using your mirror. Place your fulcrum on the mesiolingual occlusal cusp of number 3. Place the instrument on the distal surface with the toe pointed distally to see if you have the correct end. The terminal shank should be close to parallel. If you are not sure, check the other end. The face of the blade should not wrap around the distal. Once you've determined the correct end, adapt the end 1/3 about 1 stroke mesial to the distal line angle. Close the blade, insert to the junctional epithelium. Open the blade and activate the stroke with lateral pressure. Close the blade and relax your grasp as you reinsert to the base. Complete the next stroke by opening the blade to 70 degrees as you again apply lateral pressure and activate the stroke as you pivot away from the tooth. Keep the strokes short and overlapping as you continue to the midpoint of the distal. Roll and pivot on the fulcrum to keep the end 1/3 adapted to the tooth surface. Once you have completed the distal, remove the instrument and slightly change your fulcrum position to the distal occlusal. Insert the end 1/3 of the blade about 1 stroke distal to the distal line angle. Repeat the same steps you have been using. Close and insert to the base. Open the blade as you apply lateral pressure and activate the strokes. Keep the overlapping short strokes going as you complete the facial surface. Roll the instrument between your finger and thumb and pivot on your fulcrum to keep the end 1/3 adapted around the mesial facial line angle and onto the mesial surface. Once you have scaled to the midpoint, close the blade and remove the instrument. Repeat all of these steps on tooth number 4. Start at the distal line angle and go distally. Then remove the instrument and readapt at the distal line angle and insert. Activate across the facial and mesial surfaces. Keep watching the terminal shank and you should be at 70 degrees on the mesial surface with the terminal shank slightly tilted in toward the mesial surface. Keep using short overlapping strokes as you repeat for the next tooth in the sextant. In closing, it is suggested that you view this video frequently to increase your knowledge and skills in the use of universal curettes.